Lung diseases often start silently, and early symptoms are easy to miss if you're not aware. A persistent cough lasting more than a few weeks, or shortness of breath during routine activities can be early warning signs of lung disease. Chest tightness, wheezing, or discomfort while breathing may indicate airway inflammation or reduced lung capacity. Frequent chest infections, repeated colds, or slow recovery from respiratory illness should never be ignored. Unexplained fatigue can also signal poor oxygen supply. Early diagnosis saves lung function and lives. Consult a pulmonologist if these symptoms appear.